everyone, we are here at Minton Medical Clinic and Aesthetics. I'm joined by Dr. Minton and Dr. Dyer and Marla here. And we here, Dr. Minton, thanks again for having daytime here, but we want to talk about something that we haven't talked that much about. We've talked about the aesthetics part of your clinic, but what a lot of people may not know is that you guys also focus on primary care here as well.
We do. We have primary care, urgent care, and today Dr. Dyer is going to be doing a procedure on Marla called acupuncture. And so we'll turn it over to Dr. Dyer.
Yeah, and so Dr. Dyer, you were the medical director here at Minton Medical Clinic and Aesthetics. And so tell me a little bit about what we are doing here today on Marla.
So I've already met with Miss Marla and we've gone over her medical history and I've done a brief exam on her. But today we're going to do something called medical acupuncture. And so a lot of people have heard of acupuncture, and what makes medical acupuncture a little bit different is that, you know, acupuncture is a very old medical art, and there's lots of ways of learning it and practicing it. But medical acupuncture specifically is where individuals or providers such as myself who have been traditionally trained in Western medicine or American medicine, if you want to call it that, have gone on to obtain additional training in acupuncture. And so it's just the incorporation of both worlds of traditional Chinese medicine with traditional Western medicine into an art where you can treat multitudes of conditions. And with Miss Marla today, we're going to do just a basic, you know, what I call an introductory or a calming treatment just to kind of balance her system. I've already put one needle in the back of her head, and then we've laid her down, and I'm going to put some additional needles in her hands and in her feet.
Wonderful. And so why do people seek acupuncture? There's a lot of different reasons why people turn to acupuncture. Can you list off some of those reasons why?
So the World Health Organization actually has a list of conditions that they support and agree that acupuncture is beneficial for. And it covers the whole gamut from digestive disorders, respiratory disorders, urinary and menstrual problems. But a lot of the research certainly supports the use of musculoskeletal conditions or physical manifestations of stress and tension and emotional conditions.
Right, and so tell me a little bit about the needles themselves. Do they hurt? What will the patients feel? So
that's a common question, and certainly we can get Marla's feedback on that when we do the procedure. But the needles are not the same as the needles that you get like for an injection or for a blood draw. Acupuncture needles are solid, and they are smaller and thinner. They're not a cutting needle like a traditional needle. So the perception you get when they enter the skin is much different. Most people don't feel it at all. If you do feel it, sometimes you might have a dull ache type sensation, but generally that goes away very quickly.
Okay, so we'll let you kind of get started. If you can walk us through exactly where you're putting the needle and why are you putting that in that specific area on Marla? So
the treatment that I am doing is like I said, it's a basic balancing technique. So it uses some very powerful acupuncture points, and with acupuncture there are different channels or pathways called meridians, and you use big strong points such as the ones in the hands and the feet to kind of get things moving. So the basic way I describe acupuncture is our body inherently has electrical energy. Our nerves are pure electricity. Our heartbeat is actually a manifestation of electrical input that causes muscle contraction. And if you think about an injury or an illness as a blockage of the body's natural electrical flow, acupuncture uses the small metal needles to push or pull or otherwise redirect to open up those pathways and to kind of get your body back to restoring itself.
Right.
So acupuncture is very big on using the body's natural healing capabilities to restore health.
Right, and so we saw that you were putting them in Marla's hands, and now you're putting them in her feet. And so how long do you leave the needles in?
So it really depends on the treatment. No two acupuncture treatments are the same between person to person or even within the same person. It really depends on what symptoms they're experiencing at that time, what your goals for treatment are, what conditions you're trying to treat. And so like I said, her treatment is just kind of a general well-being type treatment. So like if we weren't sure exactly what we wanted to treat, or she's doing pretty well but she just likes to have acupuncture for maintenance, this is a good treatment just to kind of calm and kind of reset the body.
Right, and so Marla, I gotta ask, what was your reaction when you got those needles put in? How do you feel?
I feel great. Yeah, I feel warm all over, like a warm, fuzzy feeling.
Yeah, very relaxed.
Relaxing, yes.
Good, good. And so, Dr. Minton, I want to bring you in now.
Okay.
Why do you want to be able to offer acupuncture here at Minton Medical Clinic and Aesthetics?
Well, we offer a lot of things, and within the aesthetics division, you know, we offer the acupuncture, we offer microdermabrasion, scar treatment, vein treatment, hair reduction, so many things. But there's so many people that have pain and they seek so many other routes, and it's just not very effective, or they get addicted to medications. And this is just a good natural way to maintain that pain and to manage it. And Dr. Dyer is just so skilled in it, and I'm honored to have her here. And Marla, I can tell you're so calm and relaxed.
She might take a little nap here, huh?
Are you?
I'm just warm and fuzzy.
We love that. We love it. And so, Dr. Dyer, and the best part is people can come in and talk to you about maybe what they're really seeking. If they are seeking, you know, maybe just relaxation or pain management, right? And you can figure out what's best for them.
Absolutely. We have a questionnaire that we have them fill out, which they can list what their concerns are, ask some questions about their history, you know, kind of some different things that might lead me down one treatment pathway or another. And so we really work together to address not only what their primary concerns are, but other things that I see that may be going on that may be contributing that they don't realize.
Right.
And like Dr. Minton mentioned, specifically, you know, in this area with a lot of chronic pain and a lot of drug addiction that we see, acupuncture can be a good alternative type treatment for individuals who don't want to rely on medications.
Right. Well, I love that. Dr. Minton, Dr. Dyer, Marla, thank you all so much for letting us be here. We really appreciate it. Make sure you contact Minton Medical Clinic and Aesthetics today. You can talk to Dr. Dyer about acupuncture to help you maybe manage that pain, or if you just need a little relaxation, make sure you give them a call today. The preceding portion of Daytime Tri-Cities was sponsored by